I want to now switch gears to something that when people hear, they kind of say, oh my goodness, sepsis. And if you don't know what sepsis is, it's very serious. It's an infection that can damage organs, causing them to fail. And for decades, it's been the leading cause of death in hospitals. So break it down for me, doctor, in terms of what it is and why it's just so dangerous.
So sepsis is a general terminology, basically. It doesn't describe a specific infectious diseases, but any infectious diseases can lead to sepsis, okay? So sepsis is a terminology that we use in medicine to basically describe very severe infection, okay? And there are some parameters that are used by the physicians to determine that the patient is septic or not.
Okay.
But for general public, it means when we use the patient is septic or you have sepsis, is that the infection is very severe. And so severe sometimes that your blood pressure drops, that you are tachycardic, meaning your heart goes fast, that you are breathing very fast because you have shortness of breath, and that you have fever, and that your immune system has kicked up because there is an infectious process. One thing that happens when you get an infection is that the result of the outcome from the infection comes from how aggressive the bacteria can be, and how likely are you to respond to the infection. I mean, if you are immunosuppressed, you are less likely to respond. And also have to do with how exuberantly your immune system responds to the infection. And what you want is a balance there.
Sure.
You don't want the immune system to go crazy, because that can destroy your organs as well. And then when we mean sepsis also, then the organs start to fail because of the severity of the infection. So that's the general terminology. And as I said, you can have tuberculosis and have sepsis. You can have influenza and have sepsis. You can have pneumonia and sepsis. You can have urinary tract infection and sepsis. Or you can have them without sepsis when you don't have a severe infection.